Hi, this is Dr. Matt Rasmussen here with Periodontics and Implant Dentistry of Tallahassee. We've been getting lots of questions about dental x-rays, so we wanted to spend some time going through the most common questions we've gotten regarding dental x-rays. A dental x-ray is an image that's taken so that the doctor has the opportunity to diagnose things that cannot be seen with the naked eye. Dental x-rays are taken at a particular interval around the entire mouth. Typically that's every 2 to 3 years. Some areas may need to be taken more often than that if it's used in a specific case. And if there's any area that's suspect, we may have an issue going on. We will take an additional image as needed. The purpose of a dental x-ray is to aid the doctor in making an accurate diagnosis. This goes along with the things that the doctor can see in the mouth clinically with their own eyes, as well as through the actual clinical exam itself. But the x-ray does additional imaging that allows us to see things that otherwise we would not be able to see. There's a number of different types of dental x-rays. We'll go through a couple of the common ones here. Most of them are labeled based off of the location that they're going to be used for. Some of the common x-rays that you will have heard about would be something called a bite wing x-ray. Bite wing goes basically between the teeth and catches where cavities are. Another common type is known as a PA, or a periapical radiograph. That area is going to capture the very end of the tooth and the infections in that area. Another x-ray that's commonly taken in the dental office is referred to as a pano. It's a panoramic radiograph. It's one that goes around the head, allows us to see some additional structure. An additional type of x-ray that's taken in our office is something known as a CBCT, or a cone beam CT. It's a 3D x-ray that allows us to see all around the head and neck structure. Fortunately, dental x-rays are very safe today. The amount of radiation, which is the most common concern that patients have, has been greatly reduced while still having the same quality of image. Dental x-rays show a number of different conditions that can happen in the mouth. One of the most common ones that people will notice is a cavity, otherwise known as caries in the mouth. They'll have an opportunity to show us those in spots where it's very difficult for the dentist to see. There are many other dental conditions that can be noted to have evidence on the x-rays as well. One of these is periodontal disease. If there's a significant condition and it shows on the x-ray, the likelihood of periodontal disease being present is very high. That being said, in addition to the x-ray, there needs to be additional information taken to make sure if there's an accurate diagnosis of periodontal disease. The dental exam should be done in a regular interval. So if you've been to your regular dentist, everything is healthy, then the truth is you're going to be sticking on with your regular plan. But if you've not been to the dentist in at least the last 6 months to a year, or there's not a current plan in place, it's important to go ahead and get that dental exam scheduled. That way we take care of any issues before they become a much larger problem. There are certain things that we can see on an x-ray that commonly show areas that would look very much like periodontal disease. So by looking at the image alone, we have a high likelihood of knowing indeed there's an issue. However, when you come in for your exam, we'll do other clinical findings to confirm that diagnosis. I hope these videos have helped clear up a lot of the questions that you may have about dental x-rays. If you have any additional questions or are ready to get an exam with us, please give us a call at area code 850-692-9200.